celebrated as International Women's Day around the world, where we recognize women for their cultural, political and socio-economic contributions to society. And here's wishing all of you listeners a very, very happy Women's Day. Today's women are multifaceted. They not just actually take care of their careers and their personal aspirations, but also of their family. But in all of this juggling, they forget one of the most important things that can support this journey of theirs, and that is their health. Which is why this International Women's Day, Alkem Oncology is spreading awareness about 3 major cancers which are most prevalent in India: breast cancer, ovarian cancer and cervical cancer, through their educational initiative She Beyond Pink 2.0. This would help women know what the screening options available to them or what symptoms would actually look like, so that they can pursue healthier lives dedicated to their passions. Which is why we have today on Radio City our doctor, our expert, who will spread awareness about the same from Alkem Oncology. Thank you, doctor, for taking out your precious time.
Doctor, what is breast cancer and what is the risk factor associated with it?
Okay, so basically बहुत से महिलाओं को ये lumps होते हैं breast में. A lot of women get lumps at some point during their lifetime, और ज़्यादातर these are non-cancerous lumps. So there is really nothing to worry about. But one out of 100 or 1 out of 200 women can have cancerous changes in the lump, और तब हम बोलते हैं कि लेडी को breast cancer हो गया है.
Okay.
अभी इसके लिए we really recommend कि 20 साल होने के बाद आप breast self examination सीखिए. ये तरीके से आपको अपने breast के बारे में जानकारी होगी कि आपका normal feel कैसा है. तो कुछ भी अलग हो या कुछ भी लगे हाथ पे, आपको लगे कि lumpiciousness, तो आप तुरंत डॉक्टर के पास जा सकते हैं. So don't ignore your breast health. Be very important. Be very careful, vigilant. और मैंने पे ये आप गूगल पे आप सर्च कर सकते हैं ब्रेस्ट एग्जाम सेल्फ एग्जाम कैसे होता है. और हर साल जब आप आईना के पास जाते हैं तो उनसे रिक्वेस्ट कीजिएगा कि दे डू अ क्लिनिकल ब्रेस्ट एग्जाम फॉर यू साल में एक बार. और 45 होने के बाद एक बेसलाइन मैमोग्राफी करें, डिजिटल मैमोग्राफी. और 50 के बाद हम यूजुअली एवरी ईयर मैमोग्राफी रेकमेंड करते हैं. आपके जो नॉर्मल डायबिटीज के टेस्ट होते हैं, हार्ट के टेस्ट होते हैं, तो उसके साथ आप जरूर एक मैमोग्राम, डिजिटल मैमो कीजिए. उससे अगर कोई भी खराबी हो, कैंसरस हो, नॉन कैंसरस हो, तभी भी हम तुरंत उसे पकड़ सकेंगे.
Doctor, what are the signs and symptoms of breast cancer and how can it be prevented?
रोज मेरे से ये question पूछा जाता है, because I have this wonderful lady sitting in front of me, and when I break the news to her कि शायद आपको breast cancer हो सकता है, she does break down very often. और मुझे काफी बार पूछते हैं कि डॉक्टर मैंने कोई खराब चीज नहीं की है लाइफ टाइम में, मैंने टबैको यूज नहीं किया, अल्कोहल तो बिल्कुल नहीं, मैं डाइट करती हूँ, मैं एक्सरसाइज करती हूँ, तो फिर मुझे क्यों हो गया है. So this is a very common question that you are also asking me today. तो ये ख्याल किया जाए कि our lifestyle, जीवन शैली जो बोलते हैं, वो बहुत बदल चुका है. So in the last 30 years, cities में जो है, हमारा जो लाइफस्टाइल है वो स्ट्रेसफुल हो गया है. हम भागदौड़ बहुत करते हैं, हम डाइट ठीक से नहीं कर पाते, हम ज्यादा फैट लेते हैं अपने डाइट में, क्विक फूड लेते हैं, प्रिजर्वेटिव के साथ खाना लेते हैं. एक्सरसाइज तो कम ही हो गया है क्योंकि आजकल वॉशिंग मशीन है, आजकल घर पे काम करने वाले लोग हैं. हम गाड़ी में बैठ के अगर हमें पास में भी जाना हो स्टोर में, हम चल के तो नहीं जाते क्योंकि इतना क्राउडेड है जगह, तो हम यूजुअली गाड़ी लेके जाते हैं. सो आवर एक्सरसाइज ऑन अ डेली बेसिस हैज रिड्यूस्ड. देन जैसे मैंने डाइट का कहा, देन विमेन आर गेटिंग मैरिड लेट, women are not breastfeeding enough. 6 महीने का breastfeeding, 6 महीने के breastfeeding से breast cancer से protection मिलता है, वो नहीं कर पाते. Having the first child after 30 is a little harmful. और जो लोग शादी नहीं करते और बच्चे भी obviously पैदा नहीं करते, तो उनका रिस्क भी बढ़ जाता है. So these are some of the hormonal factors for breast cancer. But one must remember कि 10% में, 10% में ये अनुवांशिक रहता है. So it can be inherited by bad genes from either the father or the mother. तो
Okay.
ये बहुत जरूरी है अगर आपके फैमिली में मदर को या मासी को, यहाँ नीसेस, कजिन्स या ग्रैंड पेरेंट्स को, किसी या बहन को कैंसर हुआ हो और स्पेशली ब्रेस्ट या ओवेरियन कैंसर, तो आप प्लीज एक बार अपने ऑन्कोलॉजिस्ट या कोई स्पेशलिस्ट से जाके मिलिए टू फाइंड आउट व्हाट योर रिस्क इज। मैं नहीं बोल रही आपको होने वाला है, लेकिन आपको रिस्क है कि नहीं ये आप जरूर मालूम।
Doctor, what is ovarian cancer and what is the risk factor associated with it?
Ovarian cancer is a group of diseases that originates in the ovaries or in the related areas of fallopian tubes and the peritoneum. Women have two ovaries that are located in the pelvis, one on each side of the uterus. The ovaries make female hormones and produce eggs for reproduction. The peritoneum is a tissue lining that covers the organs in the abdomen. So the risk factors for ovarian cancer are increasing age, nulliparity, a history of infertility, a history of polycystic ovarian syndrome, and a family history of breast or ovarian cancer.
Doctor, what are the signs and symptoms of ovarian cancer and how it can be prevented?
So ovarian cancer has some subtle signs it can prevent with various symptoms, signs and symptoms like pain or pressure in the lower abdomen, abdominal or back pain, bloating, feeling too full quickly or difficulty in eating, abdominal swelling or distension, ascites, that is fluid in abdomen, a change in your bathroom habits such as more frequent or urgent need to urinate and or constipation. So these are the common symptoms.
Doctor, what is cervical cancer and what is the risk factor associated with it?
Cervical cancer is the most common cancer you can say in the females, especially in rural background, and this is usually caused by, you can say, like the Akshay Kumar movie Padman, that he highlighted that there should be a hygiene. So if we keep the good hygiene, then it will be lesser, and also the patient, they multi-parity, that means the more children are also the cause of the cervical cancer. Other than this, sexually transmitted diseases and unsafe sex is also the most among the common causes of cervical cancer. Apart from this, smoking and alcohol is also a risk factor for the cervical cancer.
Doctor, what are the signs and symptoms of cervical cancer and how can it be prevented?
Cervical cancer is usually begins with the post-menopausal bleeding. You can understand that after menopause, when the regular menstrual cycles has been stopped in a female, and then patients sometimes complain of bleeding after menopause. This is the first symptom. Otherwise, there may be some backache, then sometimes white or you can say foul ordering discharge per vaginum, and sometimes urinary difficulties are also seen. In advanced disease, sometimes the lower limb swelling, that means leg swelling, is also the symptom among the common symptoms. So, and for the prevention, as I highlighted, that this is in our hand maximum time, that is to be safe. Why should we wait for the Akshay Kumar? We should maintain the hygiene, right? Without this saying, and we can have a safe sex habits, avoid the smoking, and the one more thing is that vaccine is also available, that is called human papilloma virus vaccine, and that is also easily available in India, even in you can say the small towns also, where the females from the age of 9 to up to the 26 are the most eligible females for this vaccine, and these are given usually 3 doses, one at 0, 2, and 6 months, and this can prevent the cervical cancer caused by human papillomavirus with a 100% efficacy. So this is the most among the prevention, and another prevention is called the secondary prevention. This is called by the screening programs. So for the screening, that we usually recommend for the females to please visit a nearby gynecologist or nearby physician, or come to us for the screening program for the screening purpose. This starts in the for the cervical cancer either from the age of 21 or first sexual activity. After the first sexual activity starts, usually done once in a year, and it can be continued up to the either uterus is removed or up to the age 65. And believe me, these screening tests are so designed that these are not so expensive. Even the pap smear, I think you have heard many a times, it costs around hardly 500 rupees. Even in major cities, the cost of a pap smear, and this is done once in a year. And but these tests are quite sensitive, easily affordable, easily convincible. So a patient doesn't have any discomfort for this, and they need to come only the once in a year. So 500 rupees once in a year enable you to be diagnosed as cervical cancer if you have in an early stage where you can be cured completely. You believe that the results of cervical cancer are the more than the 90 or 95% in stage 1 if it detected early. So it is quite a simple disease like if it is detected early. So this is need to be aware that they should come for the screening test. We can stop this.
Thank you so much, doctor, for sparing that information, especially on the cancers most prevalent in India. I would like all the women listening in fact, everyone listening in on this International Women's Day, that if you experience any of these symptoms, please do not delay and consult your doctors and make sure that you live a healthier life so you can achieve all those dreams that you aspire for. She Beyond Pain 2.0, an initiative by Alkem Oncology.